Welcome to Medical Dialogues. I'm Dr. David DeRose. My guest, Dr. Greg Steinke. We're speaking about a perplexing question, and that is, can controlling your blood pressure better help you avoid the ravages of COVID-19 if that infection comes knocking on your door? Greg, we've talked in previous episodes about how some of the evidence is suggesting that, well, if you can control your blood pressure and normalize it, you might be at less risk from this virus. What do you think?
I think that's definitely the case, David. There's a lot of factors that we've looked at that can increase your risk, and I want to just to you a little bit about those. Certainly, high blood pressure, uncontrolled high blood pressure, would increase your risk. I mean, one of the patients that I saw had a stroke in the middle of the COVID-19 infection. So obviously, if your blood pressure is very uncontrolled, that's a significant increased risk of a stroke. If you're having a strong infection like COVID-19 on top of it, you're only amplifying your risk in that moment.
Wow, wow. We definitely, I know you've got a whole construct of things that increase risk and decrease risk, and we want to look at that in a future episode. But today we really wanted to leave people with some things that could help them control their blood pressure naturally so they could work with their healthcare provider. Maybe it's by telemedicine in this day, but at least get those blood pressure medications down if possible as they're implementing other healthy lifestyle practices. So, Greg, what kind of things are on your list as one of the authors of the book 30 Days to Natural Blood Pressure Control? I know you've written extensively about it, and full disclaimer, I'm one of the authors of the book as well. So, what kind of things would you like to emphasize to folks today?
Well, David, as you know, we have a no pressure solution to lowering your blood pressure, and it's a simple acronym. Let's just go through it quickly. N is nutrition. O is optimal choice of beverages. P is physical activity. R is rest. E is environment. S is stress management. The other S is social support. U is use of natural adjuncts. R is refraining from pressures and excesses. And E is exercising faith in God. And each of these topics have specific details related to them that can improve your blood pressure significantly. And you, as a patient, may only be particularly having a problem in a handful of them, maybe one or two, maybe all of them. And the only way you're going to get your blood pressure down is to address the issues that are relevant to you.
So, Greg, let's give some practical things that someone could say. I watched this video. I started doing this. I've got my blood pressure coming down. And why don't we talk especially about things that would also give people maybe a boost to their immune system in and of themselves? Is there anything that comes to mind like that?
Well, sunlight definitely comes to mind. Sunlight immediately lowers your blood pressure the moment it starts hitting your skin. It
Wow.
starts to create nitric oxide in your skin through the reactions that occur there. And the nitric oxide starts to go into your bloodstream and dilate your blood vessels. Impressive. The sunshine obviously also increases the amount of vitamin D production in your body. Vitamin D is a potent factor involved with upper respiratory infections. The lower your vitamin D levels in your blood and in your body, the higher your rate of upper respiratory infections.
So what I hear you saying is vitamin D is good. It's important for the immune system. But if there's a way to get that vitamin D from sunshine, you'll be getting an additional benefit or additional benefits from the sunshine above and beyond the vitamin D.
Absolutely. Another factor that comes to mind very rapidly is sleep, David. Sleep, as we've learned, is a potent issue related to upper respiratory infections. Sleep is also a potent issue when it comes to high blood pressure.
So better sleep, lower blood pressure. For me, one of the more compelling connections with that is it seems like people that are cutting themselves short on sleep, their bodies have to ramp up their stress hormone levels to keep them functioning. I know some people get some help from caffeine to do that. Is that seem to be the main connection with lack of sleep and higher blood pressure?
That is probably the biggest connection for sure. Increased inflammation that comes through the lack of sleep probably is leading the blood vessels to be more inflamed and to have a harder time dilating. The other issue that really was shocking to me recently was when I reviewed a randomized trial that showed that people who got less than 7 hours of sleep on average were 300%, David, 300% more likely to have an upper respiratory infection.
What about activity? We talk a lot about it in our book, 30 Days to Natural Blood Pressure Control. Just how important is that as far as immune functioning?
Physical activity is a wonderful stimulator of your immune function. The heat that you generate through your exercise stimulates your immune system. It's almost like a fever effect, where that increases the innate immune system. Your macrophages get activated. They start looking around, hunting for viruses and bacteria to kill. It stimulates your adaptive immune system, which is the part that makes antibodies. All of that is stimulated with exercise. Now, keep in mind, if you excessively exercise, like a marathon level type exercise, you actually increase your risk of an upper respiratory infection. But that's not the issue for most people.
Very good. Greg, a lot of practical pointers. I know we want to talk in a subsequent installment of this series about just kind of an overview, things that we can do to improve our immune system, things that we should avoid, things that we should do. We've got that coming up in a future segment. But hopefully you as a viewer, you've taken away from this some practical things you can do that can not only help your immune system, but also help lower your blood pressure. And with that, maybe even help you decrease some of those medications. I'm Dr. David DeRose. That's all for today's edition of Medical Dialogues.